The placebo effect, a fascinating phenomena in medicine introduction to human mind, is a powerful entity that can influence bodily functions in unexpected ways. One of the most intriguing demonstrations of this power is the placebo effect. The placebo effect refers to the physiological and psychological improvements experienced by a patient after receiving a treatment that has no active therapeutic ingredients. This phenomenon has been extensively studied in medicine, psychology, and neuroscience, revealing its significant impact on health outcomes. This article explores the history, mechanisms, applications, and ethical considerations of the placebo effect, providing an in-depth analysis of this fascinating aspect of human health. Historical background: placebo effect has been recognized for centuries, even before the advent of modern medicine. In ancient civilizations, healers and shamans often administered rituals, herbs, and other treatments that, while lacking scientific efficacy, provided relief to patients through belief and expectation. The term placebo itself originates from the Latin word meaning "I shall please," first appearing in medical literature in the 18th century. One of the earliest documented scientific investigations of the placebo effect was conducted by Henry Beecher, an American anesthesiologist. During World War II, Beecher observed that wounded soldiers who were given saline injections instead of morphine still experienced pain relief, leading him to explore the role of expectations and psychological factors in healing. His work laid the foundation for placebo-controlled clinical trials, now considered the gold standard in medical research. Mechanisms behind the placebo effect. Placebo effect is not merely a psychological illusion. It involves complex neurobiological mechanisms that influence pain, perception, immune responses, and even disease progression. Several key factors contribute to the placebo effect: expectation and conditioning. When a patient expects a treatment to work, the brain releases neurotransmitters such as dopamine and endorphins, which can reduce pain and enhance well-being. Additionally, classical conditioning, where a person associates a treatment with a positive outcome, can reinforce the placebo response. Neurobiological changes. Studies using brain imaging techniques, such as fMRI and PET scans, have shown that placebo treatments can activate specific brain regions associated with pain relief and emotional regulation. These include the prefrontal cortex, the anterior cingulate cortex, and the nucleus. Hormonal and immune system responses. Placebos can trigger the release of endogenous opioids and other hormones that modulate pain and inflammation. Moreover, they can influence immune system activity, improving recovery in some conditions. Doctor-patient interaction. The relationship between healthcare providers and patients plays a crucial role in the placebo effect. A compassionate and confident doctor can enhance a patient's trust and belief in treatment, amplifying the placebo response. The role of placebos in clinical trials. Placebos play a critical role in scientific research, particularly in randomized controlled trials. These trials compare the effects of an active treatment against a placebo to determine the true efficacy of a new drug or therapy. If a drug performs significantly better than a placebo, it is considered effective. Placebo-controlled trials help eliminate biases and psychological influences, ensuring that any observed benefits are due to the drug itself rather than expectations. Without the use of placebos, it would be difficult to distinguish between real pharmacological effects and psychological improvements. Placebo effect in different medical conditions. Placebo effect has been observed in a variety of medical conditions, ranging from pain management to neurological disorders. Some notable examples include pain relief. Placebos have been shown to reduce pain in conditions such as migraines, arthritis, and post-surgical recovery. Patients who believe they are receiving painkillers often report significant relief, even when given inert substances. Depression and anxiety. Many antidepressant medications show only a modest advantage over placebos in clinical trials, highlighting the powerful impact of patient expectations in mental health treatment. Parkinson's disease research has demonstrated that placebo treatments can stimulate dopamine release in Parkinson's patients, temporarily improving motor function. Irritable bowel syndrome. Studies have found that placebo treatments can alleviate symptoms of IBS, possibly through the modulation of gut-brain interactions, immune function. Some research suggests that placebos may influence immune responses, aiding in recovery from infections and inflammatory conditions. Ethical considerations of the placebo effect. While the placebo effect offers promising insights into the mind-body connection, its use raises several ethical questions. The primary ethical concern is deception. Giving a patient a placebo without their knowledge violates the principle of informed consent. However, recent studies suggest that even open-label placebos can still produce beneficial effects. Additionally, the use of placebos in clinical practice must be balanced with medical integrity. Physicians must ensure the patients receive the best possible care, while considering the potential benefits of placebo responses. Harnessing the placebo effect in medicine. Given the power of the placebo effect, researchers and clinicians are exploring ways to harness it without deception. Some potential strategies include enhancing doctor-patient communication. A positive and empathetic interaction between healthcare providers and patients can enhance treatment outcomes even when using active medications. Optimizing treatment context. The way a treatment is presented, including its packaging, color, and method of administration, can influence patient expectations and improve efficacy. Mind-body therapies. Techniques such as meditation, hypnosis, and cognitive behavioral therapy leverage psychological mechanisms similar to the placebo effect and can be used as complementary treatments. Open-label placebos. Some studies have found that even when patients know they are receiving a placebo, they still experience symptom relief. This approach could allow medical professionals to use placebos ethically in certain cases. Conclusion: placebo effect remains one of the most intriguing and complex phenomena in medicine. Its ability to influence health outcomes through expectation, conditioning, and neurobiological mechanisms demonstrates the profound connection between the mind and body. While ethical challenges remain, ongoing research continues to explore how the placebo effect can be ethically and effectively integrated into medical practice. Understanding and utilizing the placebo effect could revolutionize the way we approach healing, offering new avenues for treatment in both physical and mental health care. As science advances, the potential for leveraging this phenomenon in ways that complement conventional medicine remains an exciting and promising frontier.